What do we know so far about the mitochondrial-derived peptides? Because some of them are famous, some of them are very famous, several celebrities, I would have said, and some of them are hardly known. So who is the celebrity? Well, of course, the Humanin, and it is known to have the potent immunoprotective effect, specifically antagonizing against the Alzheimer's disease and the amyloid beta protein. And of course, we do know now that the beta amyloid has got nothing to do with the occurrence. Yeah, it's not the cause of the Alzheimer's, but it's one of the factors that make it a bit difficult to treat. The small humanin-like peptides, they have potent cytoprotective role, and specifically fractions 2 and 3 are involved in the insulin synthesis and the insulin sensitivity. And also it is known to increase the level of leptin directly, which is a factor or the hormone which is improving insulin sensitivity. What else do we know about the mitochondrial peptides? How do they work? You know, the pathways. They improve or they promote the cholesterol translocation from outside, from the cell cytosol inside the mitochondria, and they activate the mitochondrial cholesterol side chain cleavage. What it means that the cholesterol, which is the starting point from which the pregnenolone is produced, we found that the cortisol and the DHA and all 48 steroid hormones, and basically that's all are the derivatives, the metabolites of the cholesterol, so it's happening there. The import of the proteins from the cell inside the mitochondria. The mitochondrial peptides have a very strong anticoagulant function, so basically they save lives and help us not to die from the acute cardiac events. They also directly modulate alpha-synuclein, and the malfunction of this process is related to the Parkinson's disease, and they selectively bind to the cardiolipin and modulate the interaction with cytochrome. You know, cannot be more essential than that. I can hardly think of any other intracellular enzymes or intracellular proteins that have more significance, bigger significance than mitochondrial peptides. This basically, this slide shows the main steps of how the mitochondrial peptides are produced. You know, it's similar to other production of naturally occurring peptides and conversion them into the ready-made biological product, which is ready and used for the clinical application.